Hello, and welcome to another episode of Spotlight on Health. I'm your host, Dr. Stephen Eschenauer, the Health Officer at the Kanawha-Charleston Health Department. Today we have two guests who have interviewed me previously, and we're flipping it to the other side today. We have both Lori Kersey and Trey Kay with us today, both do some reporting in the health space. So Lori, tell us a little bit about how you ended up in journalism.
Okay. I was born and raised here in the Charleston area in Sissonville, and kind of always knew that I wanted to be a writer. Probably got told at a young age, it was being told at a young age that I was good at writing, and that kind of stuck. But I went to school at Marshall, stayed here and went to school at Marshall and their journalism program. Spent a couple of years reporting in smaller areas in southern Ohio and Kentucky, and then when an opening at the the Charleston Gazette opened in 2011, I went back to Charleston and took that job.
Mm-hmm. Now, didn't you spend a little time at the health department yourself?
I did, yeah. So I was at the Gazette. Subsequently, the Gazette Mail for nearly 8 years, I think, and then 2019 I decided to kind of do something different for a little while and decided to take a job. The PIO was moving into a different role, so I took that role, and incidentally it was right before the pandemic started. So I started, I think, in May 19, and then we're kind of thrown into this global pandemic.
Into the fire,
which we said during the time it's everybody's first pandemic, but it was a lot. It was a big thing to learn to do public health communication in the middle of a global pandemic. That was certainly the fire.
Oh,
yeah.
yes.
Yeah.
You probably had plenty of overtime during that time.
Yes. Yeah. Well, and the other part of it, and I say this just because it was pretty public at the time. I wrote about it in the Gazette. The other part of it was I got breast cancer in the middle, like the very first day that we had a case here in Kanawha County. I was diagnosed with breast cancer.
Oh my.
And so everything was shutting down, and we had all this fear around getting disease, this new virus, and then add to that this fear of going through chemotherapy in the middle of trying not to get sick, and then working at the health department, and it was a little chaotic there for a few months, and they were very good to let me work from home for a lot of that. So it was a lot of fielding questions about the pandemic and working with the then health officer, Dr. Young, and getting correct communication out to reporters who were also in the middle of their first pandemic and trying to figure out how to report on this disease that was emerging.
Mm-hmm.
Yeah.
Yeah.
It's interesting.
And where are you now?
Yeah, so the pandemic calmed down a little bit, and I realized that as much as the health department does great work, it just wasn't I didn't really like it as much as reporting. But it had to give me a good perspective to be a health reporter going forward. But I went back to the newspaper in, I think, 2021, that summer, and was there until last year when a nonprofit newsroom opened up in Charleston, and I went to report for them. So it's West Virginia Watch is where I'm at now, a nonprofit newsroom.
Excellent.
Yeah.
Excellent. Very good. And Trey, tell us a little bit about yourself.
Sure. If you would have met me when I was in high school growing up here in Kanawha County, West Virginia, and you would have had a crystal ball that said I was going to be a journalist, I would have laughed in your face. It was not anything that I was planning on doing. I was very interested in being a part of the Charleston Light Opera Guild and playing music and stuff like that. And I went to college to study the fine arts, performing arts, and went to New York City. And somehow through a circuitous route, I ended up at the local public radio station in New York City, working for an arts and culture show. So my initial foray into journalism was reporting about arts and culture, famous people, record albums, movies, art exhibits that were coming out. And then after doing that for a while, I got the idea to come back to West Virginia to do a documentary about the famous or infamous, whichever side you look at it on, of the Charleston or the Kanawha County textbook controversy, which happened back in 1974, and it was a big controversy about the content that were in a series of language arts textbooks at that time. Anyway, long story short, that put me in this space of looking at things that divide Americans, certain issues. And we made this successful documentary about the Kanawha County textbook controversy. It won some major awards. It won the Peabody Award, the Edward R. Murrow Award, and the Columbia DuPont Award. And after that, I realized that I was kind of in this realm of looking at the types of things that really divide Americans, that where we have kind of entrenched views on either side of the issue. Now, this could be issues like immigration, or it could be issues about abortion, guns. Those are all kinds of things that Americans have different opinions on. But healthcare issues also come up. You and I, when we interviewed at one time, we can find people who are very much on the conservative side of the spectrum, might have an issue on something like vaccinations, and people on the far left might have an issue on vaccinations. And our program, which I do with West Virginia Public Broadcasting, it started as a podcast, and it is also a radio program on West Virginia Public Broadcasting called Us and Them. And
what a great name for a show to kind of point out that there's many times at least two views to the same subject.
Yeah.
It's the same issue, the same subject, but sometimes very different perspectives and opinions on how we as a population deal with those issues.
Exactly.
Politically, financially, socially, there's so many issues.
That's right, Doc. And you know, we have found vaccinations has certainly been one. Vaccinations was, I think, one of the first public health issues that we got into. For example, as you know, West Virginia has probably some of the best vaccination laws nationally, and that was something that we spoke about, not with somebody from the health department, but then during the time of the pandemic, when all of a sudden the issue of vaccinations were coming front and center. That's when I spoke with your predecessor, Dr. Young, about exactly how we were kind of moving into this realm of whether we should or shouldn't vaccinate. And as you know, and as we continue to know, this is one of those issues that kind of straddles that us and them divide. And we also on our program, I mean, certainly West Virginia in particular, but Appalachia writ large, has a real acute issue with the opioid epidemic and substance use disorder as a general issue. And that's something where people, you know, on either side of the political spectrum have some pretty entrenched points of view. And our show, more often than not, is about not necessarily judging who's right and wrong. There's a lot of people who are going to do that. But how is it that we can have a discussion around these issues in many ways where we can try to see if we can seek understanding and get beyond the issues that trigger us into maybe an entrenched belief that makes us obstinate.
Entrenched is a good word for it, because as a physician, especially in emergency medicine, where you see all walks of life, from uninsured, homeless, to people that are extremely wealthy at the end of life, and everything in between, from delivering babies to somebody that's getting an illness for the first time to a first-time cancer diagnosis. It is very interesting to see how what I would call partisanized medicine has become. Seeing this, it's almost a partisan issue when as a physician, I always looked at it, health as a human issue. It's not a political party issue. Yet individuals, many have become, as you use the term, entrenched. And that entrenching has really caused some divides that I think medically, from a human perspective, have hurt us as a society.
You know, Doctor, one of the things that, and I'm wondering if you're feeling the same way, that we've noticed, I think where it really came on for us loud and clear was back in January of 2021, January 6th, that the riot happened at the Capitol, and we were thinking about reporting on how we could, from our little Us and Them podcast show, could report on that issue in a way that was different than maybe what was happening on the national news. And the thing that we boiled it down to was that in many ways what was happening that day was there was a large group of people who did not have trust in many of the aspects of our society. They didn't have trust in our government. They didn't have trust in our election system. And as we started kind of like pulling that out, there's a lack of trust in so many aspects of our society. And I imagine that you, turning the focus back on you a little bit, is that in some ways that's part of the battle that you're fighting.
Absolutely.
Right?
It's a big reason why I want to have shows with individuals like you who report on health and medicine, because it's a human issue. When somebody comes in and they're a patient and they're sick, they're hurt, we're all the same, regardless of race, color. None of that matters. Nothing. Health is about humans. It's a human issue. And I wish more people could see it that way, but it doesn't always come across that way, because people have very strong beliefs in what they should or shouldn't.
And maybe think that you have an ulterior motive that is something more than that you actually just want to help people.
Mm-hmm. That's a big reason that I took this job. So Lori, what have been some of your observations from this vein of trust, and whether it be immunizations or trust of healthcare providers in the system, as you've been reporting over the last several years, and being a patient yourself?
Yeah.
You've had a very unique perspective.
Yeah. I mean, I guess I would say, I used to think of health reporting as, it was not easier, but it kind of took you out of the fray of like political reporting, because you had science to
Right.
back you up, and you just report the science, and that should be enough for people, and that should be, and I still think it is. I still think that that's the way to do it, is to highlight experts, but health is so political, and I used to think that it, probably naively, excuse me, I'm popping my knuckles there, probably naively didn't realize how political it is, and how much politics play a role in everything from women's health care decisions to immunizations. Immunizations are always a big issue at the legislature, but it's a health issue, but it's also very much a political thing. Yeah.
Mm-hmm. I think one of the things that has helped my career and my perspective immensely is travel. Being a military physician, I got to go around the world a good bit, and I've spent about 5 years living overseas, plus or minus, in Asia and the Middle East. And when you've lived and seen what I've seen in communities and societies that have a fraction of what we have, it is so different, whether you're in India or in Tanzania or in Egypt or in Iraq, how those who don't have access, how much they crave the access. And when you talk and see these patients, the trust level is way, way up here, because many times you're the only hope for them or their child who has a critical disease. And overseas, we see a lot more infectious disease than what we see here, due to much lower immunization rates. And for many, it's not an option. You can't just go down to the health department and get a shot, whether it's if your insurance covers it or we give it to you for free because you need it. You're going to get required immunizations. There, it's not always even an option. That's a privilege for some. So I think we take so much of health for granted, and then we take advantage of in America that you can just go down to the ER when things go wrong, and just walk in and I've made some bad decisions in life, and now it's an emergency, and I need you to bail me out. But there seems to be a lack of responsibility for how you got there in the first place, and it's very unfortunate, and it's a big reason why, as a physician who worked in that kind of the receiving end of whether unfortunate accident or an unfortunate diagnosis or disease, or one that was secondary to some really bad lifestyle decisions, that I wanted to get into the part of medicine where we can actually influence the messaging, try to build trust from both the journalistic perspective, because you're the megaphones, and as a physician that, hey, I'm here for the humans, all humans, regardless of what your political background is, physical, mental, none of that matters. We're all people, and we should all be treated equally. But as you look back on your journalistic careers, what have been some of the biggest things that you've reported on that you felt were your best stories? Like this one was one that was really well covered by me and delivered the message that I wanted to get across. Lori, you want to go first?
I was going to say Trey.
Or do you want to noodle on it first?
Well, I'm trying to think. What sticks out in my mind, not so much anything that I necessarily won awards for or anything like that. What sticks out to me are like topics over the years that I've helped cover. And I think anytime you put out a story that helps kind of, anytime you put out a story that helps readers get more clarity on an issue, and kind of dissuade some of the disinformation that's out there about it is a good day for me. So like I started probably the big thing that was happening when I first started health reporting was like the Affordable Care Act being passed, and the need for like insurance for people in West Virginia, Medicaid expansion, and that sort of thing. And then, I'm not sure if I was the health reporter or the city reporter when 2017 or 18, when the politics around the needle exchange program at the health department that started kind of getting more and more. What am I trying to say? When it became kind of a hot topic.
It was a controversial thing.
That's the word I'm looking for. Controversial. And that led to. I can't point to one specific story, but I wrote several during that issue, and it became a very big part of the mayoral race that I covered in 2018. And then, health department. COVID would have been what I was writing about, but I was obviously working on the other side of it. Lately, I'm trying to think of what I've been covering. It's not really camping bans. I don't know if you consider that a health issue.
We're working on something about that right now, and yeah, in many ways that is a public health.
Yeah, I think so.
Issue.
Yeah.
So define what you mean by camping ban.
Okay, so it's a law that prohibits you from sleeping on the street, basically. So these are aimed at homeless people, and as homelessness has increased over the years, it's one way cities are trying to respond to it. the Supreme Court just ruled in 20.
This past summer.
This past summer, yeah. I'm not sure why I'm thinking it was years ago. No, it was this year, and in June, that they upheld a camping ban in Oregon that had been challenged, and basically ruled that it does not go against the Constitution's ban on cruel and unusual punishment to put people in jail if they have no place else, like for sleeping on the street, even if they have no place else to sleep. So. I think there's been dozens so far across the country of cities that have enacted these camping bans. Morgantown just passed one last month, I think. That one is currently not in effect yet. There's an effort there to get it on the ballot to have voters decide. But Clarksburg is also considering one. Wheeling has one. And I went up there over the summer to talk with people who. Wheeling's is kind of different because it bans people from sleeping on the street, but they have an exempted site. So they have one area of the city where they are allowing people to camp out they have no other place, basically. There's not an emergency shelter in Wheeling. There's one during the winter, but it's temporary, just for the really cold months. And so a lot of people are staying along this strip of land in the forest, basically, that they're allowed.
When I was in Bozeman, I saw an area, and there were several streets, paved streets, and it was just empty lots between them. And there were numerous outside porta-johns and numerous dumpsters.
Yeah.
And you saw a number of people camping. And I asked one of the gentlemen that lived there in the city, so what is this area here? And says, that's the designated camping area. The city keeps the trash dumped and keeps all of the porta-johns cleaned out on a regular basis. And if you need to camp, that's where you go.
Right.
So,
yeah. I think Wheeling has a similar thing. I mean, I think there's a dumpster there, and they had brought in, I'm not sure what organization whether the city or another one of the homeless providers there had brought in like showers for people and things like that. The problem that I reported on last when I was up there was that they have several women who either were fleeing domestic violence or experienced domestic violence and are homeless. And so if there's no other place for them to go, they're often in a camp next to their abuser. And they don't have a lot of other options, and the providers are very worried about that being an issue, because if you no other place to go and you're having to live with somebody that.
But this is a public health issue in many ways, because I mean we know disease is going around, and it's harder to stay healthy if you are living in a situation where you have those type of stresses of not having a home, not really having access to healthcare, et cetera. I mean, in some ways, us and them way of looking at it is, us would say, oh, those poor bums, we should, maybe move them on down the road or something like that. Just where we got started reporting on this is before the Supreme Court decision came out in this past summer, it was the Grants Pass decision, that Kentucky enacted a crime law, a sweeping crime law called the Safer Kentucky Act. And although it's got some pretty tough provisions with regard to violent crime, it does have a whole provision that has to do with the banning camping, et cetera. And it was the first thing that raised our us and them antenna. And we started to kind of look at that as an issue, because we try to report in West Virginia and also in Appalachia. But Doctor, really for us, vaccinations, as I've kind of said earlier, has been something that has really it has been that type of area where you're looking at either side. But golly, the pandemic, at first, you're one of these jobs that in one way, we couldn't get out in the field and go and talk to people like we could
Yes.
before. But we could work, right? We could get on Zoom calls, we could get on the phone. And that was something, and I don't know exactly how it was for you, but for us, we found that what our job was at the time was to try to see, to the best of our ability, explain things that where there seemed to be a lot of misinformation. So eventually vaccinations was part of it, but all of the parts that had to do with masking, social distancing, and I think when your original question was to ask, like, what were the issues that my health reporting was when they were rolling out the vaccination, and there were people who were designated as high risk. Were the vaccinations really getting to those people? We found that they were getting to the elderly and people who were healthcare providers working in old folks' homes. But we know that African Americans have higher comorbidities, and we were wondering here in West Virginia, was there the number of African Americans getting the vaccinations that were proportional to how they were represented? And in the beginning, it didn't look like it was that way. And that was a lot of the reporting that we did during the pandemic. And it was, and one of the things that I count as a success was when our report aired in West Virginia. Can I mention the name? It was Fruth Pharmacy. They heard our report, and they went ahead and they set up. They had extra vaccines, and they set up vaccinations sites throughout West Virginia where there were high concentrations of African Americans. And then also with that, we also knew that there was, going back to trust, there was a lack of trust in the African American community in some ways to the medical community, and whether or not we could take that vaccination. And that was something that we covered in our reporting. For the intersection of health and this us and them divide in America, I mean, the pandemic was a great place to explore that as an issue.
Oh, was it ever?
Yeah.
Was it ever? Well, Lori and Trey, I really want to thank you both for coming on the show, but not just coming on the show, but for reporting on what we've had, especially over the past 4 years, as just tremendous health issues, vaccinations, trust and distrust in the medical system, and to try to identify and bring it to a conversation level, not just to promote one side or the other, but to really let's look at this and let's talk about the issues and try to find common ground and a common solution to help all of us, because we're all human. As my wife says, we're all the human race. So I want to thank you all for viewing the show today. It's been very interesting to have reporters on the other side of the coin. I don't get to do this very often, but I do truly appreciate it, because they are essential to getting the message out. I'm your host, Dr. Stephen Eschenauer, and thank you very much for joining us.